Okay.
Okay. So like I said in the email, we're doing our humanities class on like globalization, and we're doing a study on the effects in our fields that we're going into.
Okay.
I figured since you're now an anatomy professor, and you have some good experience in the medical field, you might be a good candidate for me to interview.
Sure.
So I guess the first question is, so what was your specific job when you did work in the medical field?
Pathologist. I was a pathologist.
Okay.
Yep. So autopsies, cancer diagnoses, basically tissue diagnoses, stagings of cancers, stagings of diseases, those sorts of things.
Okay. So in this field, did you ever come into contact with any companies overseas and all that?
No, actually, I did most of my stuff in country.
Okay.
Yep.
So to work as a pathologist, you've obviously used a lot of technologies. Did you ever pay attention to where any of the technology?
Sorry, you cut out. So did I pay attention to where any of the technology came from?
Yes.
Most of the technology we used came from China and Taiwan, actually. That's where most of it came from. Yeah. Of course, most of it was assembled. Most of the designs for the things came from California, but the actual building of the stuff came from China and Taiwan.
Okay. Did access to any of those technologies kind of change with how like international relations?
No, actually, the access hasn't really changed. Actually, well, no, actually, I think it's actually become more accessible as the years went by. Yeah.
Okay. So you said you did most of your work in the States and in country. You didn't ever have to consult anybody from like Canada or Mexico or anything on any kind of research or anything?
No, I never had to consult anybody, but I would, being in the field that we are, I would read articles from people in Japan, Russia, Canada. I would read the journals, like pathological methods and practices, but I would never actually call anybody to actually consult on cases.
Okay. So I know that you're no longer actively in the medical field, but obviously you've spent quite a bit of time in it. What are some of the effects that you've seen from globalization in the field of pathology?
In the field of pathology, none. Actually,
None.
I can honestly say none whatsoever. The globalization, from what I've understood and what I've talked to my other colleagues, it's pretty much the primary care people that would experience this, and like surgeries. Those are the two big ones, and getting treatments where it would be cheaper. And one of the things that we've seen is a lot of insurance companies, and actually the first one to do it, I think it was Blue Cross Blue Shield of South Carolina. They actually have an overseas treatment center to send patients to because it is cheaper to do some procedures over there than it is in the United States.
Okay. So yeah, like you're kind of saying that like because of the globalization of the world that we live in today, certain things have become easier to acquire, that kind of thing.
I don't necessarily know if it would be easier to acquire, but definitely cheaper to acquire, because it's this really big deal to like get a passport, have to go overseas to get a procedure done. But it has definitely made things cheaper in other countries. Whereas ironically, in the United States, things are still very high cost. Whereas if you go to Canada, things will be cheaper. If you go to Mexico, things will definitely be cheaper. So the price hasn't equaled out as actually other countries. It's just cheaper for medicine.
Okay. All right. I think that's really all the questions I have.
Okay. Anything else?
No. Is it okay if I email you for any follow-up questions?
You can email me and I'll see you today. Are you ready for your test?
Yep.
All right. Okay, I will see you later.
Thanks.
Okay, bye-bye.
Bye.